How did it all started for you, sir? How did your journey started?
Yeah, and myself, I was keen on doing medical sciences because my father, Dr. Hanumanthachar, he's also a physician, and my two uncles are also doctors. They're all MBBS, MD. Another uncle is general surgeon, gold medalist. Another was a gynecologist. And I had seen these people, intensively working for medical sciences. And I was a child. When I was a child, I always was imagining as a doctor, whether it's possible to better me in a better way of presenting. And there was an option to choose other sciences too, but I chose myself to be an Ayurvedic doctor, and I studied that. After studying it, I felt I was very happy with the knowledge I acquired through Ayurveda, and I really felt there is a need to understand much more, and also to adopt the knowledge of modern sciences also. And there was two options: either to join again MBBS and make my 5.5 years of journey studies. I already had finished my 5.5 years. I thought it's too much. Instead of that, let me more focus on therapeutic management. My intention was to reduce as much as possible medicines and give more therapeutics, and as much as possible lessen the dosage of any chemical compounds or maybe whatever it is. My intention was that. And I studied my physical therapy and rehabilitation from Bangalore Medical College. The moment I finished my Ayurveda, I had a vision to adopt knowledge from modern science, where I got seat from Bangalore Medical College. And I studied 4.5 years. It's not easy to do 2 graduations, but I could manage and do it because I had more passion in my mind. And after that, I did my post-graduation also in physical medicine and rehabilitation. See, most of these things are all therapeutic managements, and where I could easily adopt in my Ayurveda practice. For example, in allopathic way, they say after doing MBBS, they'll do physiatry and all. They're called physiatrists. I wanted to, make myself as Ayurveda physiatrist, adopting alternative therapeutic managements along with Ayurvedic management therapeutics, and where I'm also well versed in Panchakarma therapies and also Marma Chikitsas and Meru Chikitsas. I adopted most of physiotherapy and its therapeutic managements also, and I feel really amazed to say my understanding through these two systems have given me enough knowledge, and also I'm expanding my knowledge. Then I again underwent small fellowships in a 1 month program, 2 months program, to various channels. Earlier days it was very difficult to get fellowships where we used to get trained under people whenever they visit from abroad to India. And there one lady from USA had come. Her name is Alexandria. I learned intensively all chiropractic therapeutic managements, and like that I started updating. I felt always updation is required, and when all possible, I'll keep doing it.
Very true, sir. So let's start with the session, and I would request all the attendees, if you have anything particular you would like to ask Dr. Madhusudan, please write it on the chat box. Let this interaction be, lot of interactions should be there, lot of questions should be there, so you get to know what exactly. And today we are here to actually talk about holistic medical practice and the scopes for Ayush doctors. So let's make it more interactive, doctors. So I would ask everybody to write it down on the chat box if you want to ask anything particular from Dr. Madhusudan.
Yeah, I'm here.
The screen is all yours, sir. Thank you.
Ready to share my experiences. I've prepared a small, PowerPoint presentation, and let's share this. Is it audible?
Yes, doctor. The voice is little low, sir.
Okay. Is it low? Is it audible now?
It's audible, sir.
Hello, everybody. And today.
So just make it on the screen show, sir. I'm so sorry.
Is it audible?
Yes, doctor.
Everybody able to see the
sir, it is not on the screen. It's not on the slideshow. Sorry, the slideshow. It's down, sir. near 69%.
Oh,
The other side.
is it fine then?
No, sir. The fourth one, sir. On the same line, fourth.
1, 2, 3. This one?
No, sir. 69K, just right, left to it. Yes, sir.
Okay. Done.
Yes. Okay, thank you.
Good evening, everybody. Hope all are eagerly waiting for this topic. Thank you for opportunity once again, assimilated by Medvarsity, and these people have given me a chance to share my experiences. And today's funda is about holistic medical practice, how a fellowship can be a game changer for Ayush doctors in specific. I feel most of the Ayush doctors have joined. And I feel it may not be only for Ayush doctors, it can be for any other faculties too. For example, all modern doctors also can update the knowledge. The way the entire fellowships can be, we can exchange of thoughts from ancient systems to modern system too. But this particular ideology has come from Medvarsity to share modern knowledge to the budding Ayurvedic doctors. Okay. And see, as we say, a holistic medical practice, and it's a vast science. See, when I say Ayurvedic practitioner, I don't say it's a limitation, but it's an ancient medical science. Sometime we keep ourselves to Ayurveda way of practices, where we practice with the Ayurveda medicines, Ayurveda therapeutics, and Ayurveda, way of lifestyle management and all. We keep doing it, adopting yoga also. But when I say holistic medical practice, I have to really focus on body, mind, and spirit, and how to make these all things evidence-based. It's a very important point. And I believe in most of the time treating disease along with physical body, its mind, and also the spirit factors. That's how our ancient model of system has come to an existence. And coming to important points where our expertise has come through Ayurveda. Many of the doctors in Ayurveda already know you people are practicing Ayurveda, you practice Kasta Aushadhis, you practice Shodhana Chikitsas, you practice Meru Chikitsas, you practice Marma Chikitsas, yoga, etc. And you know the significance of these all things. Okay, of course, we all study these all things in ancient way of medical sciences, and hope everybody is able to understand whatever I say. If there is any questions, we can take in later also. And see, whenever we say ancient medical system, always we try to support this with a modern knowledge. See, as we have studied most of our Ayurveda in Sanskrit, also we have studied these all things in English, try to adopt it and try to understand through allopathic knowledge also. See, we try to integrate sometimes, to understand in a better way. Always we go through modern medical sciences too. And in our entire 5.5 years of degrees, we have studied a lot of things, like we try to understand in first year, second year, third year, fourth year, and finally we have studied so much of medical sciences. When it comes to clinical practices, it's totally different. Okay, we try to find it in a very difficult sometimes to express ourselves to the patients. Then we have to adopt ourselves to modern science, and we have to explain entire Ayurveda in terms of modern sciences too. That's a necessity also. We try to understand, ancient system of science in ancient way, in Ayurvedic way, and also we try to understand, interpret in a better way, so that we can understand through modern tools. And see, when I studied my Ayurveda, it was really a passion for me to practice Ayurveda, because always I used to believe that Ayurveda has a lot of scope in chronic diseases. See, all acute cases and emergency cases I had seen throughout my life, throughout my younger days. And most of the systems, people used to rush to emergencies during their fever, cold, cough, XYZ. I used to observe closely how these all people used to, come rush for injections, medicines. My father used to work as a primary health, centers in most of the districts, and he used to manage more than 25, 30 the centers. There used to suddenly a lot of panic. Outcome of a lot of gastroenteritis, malaria kind of and all. See, these all really they used to do a lot of work on a acute emergency cases and all. But also I used to observe many times. I used to observe there are side reactions through penicillin injections and XYZ, and I had seen very closely the reactions too. people used to say, my father used to discuss in during that time, I had developed a passion towards Ayurveda system of medicines. Okay. Then I realized that when I finished my second POC, there was an option to study various degrees, various graduations and all. I opted Ayurveda, and of course, I closely missed allopathy also, but I didn't feel there is a necessity of allopathy initially. Then I started studying Ayurveda. Really, I felt very good when I was going through these all subjects. There was a lot of difficulties also in 90s, understanding and interpreting Ayurveda in a Sanskrit and in different languages and all. It was little tough initially, but I could really correlate well because I was very much interested. We used to really correlate with so much of modern medical sciences. Also, we used to compare with those books and all. We used to study, and amazingly, whenever we studied deep and deep, always we used to I used to feel, oh, Ayurveda, these books already have told about this kind of symptoms or this kind of characteristic features or this kind of medicines. The more and more we understood depth, I always had a respect. My respect towards Ayurveda started growing, and I was really amazed. Then when I finished my Ayurveda, I started practicing Ayurveda in a day in a clinical setup, and I was getting very good results. I started with Ayurveda, then I started adopting Panchakarma. I really started getting very good results, and most of the chronic disease we could say we can cure them. It was very happy to say this, and we have cured many diseases and many chronic diseases. People who used to take a lot of chemical compounds for months together, we could really stop them through our Shodhana Chikitsas and Shamana Chikitsas and thoughts XYZ factors. Okay, and when I started studying physiotherapy, it was a tough journey for me. Evening I used to practice Ayurveda clinical studies and works, and morning I used to study physical therapy and rehabilitation, where my 97 to 2000 journey was very tough. Morning I used to go to college in the regular classrooms, and I used to sit, and again I used to understand therapeutics of electro exercises, and it's a lot of other subject, a lot of different subjects in physiotherapy. Because of that, I like this subject because it's totally therapeutic management. There are no drugs at all in this. Entire is a therapeutic management. Our understanding of yoga through physiotherapy becomes much more, modern and evidence-based. And we started understanding electrotherapy, exercise therapy, and there was a lot of scope for, adopting this all therapeutic knowledge in my Ayurveda clinic also. I started integrating Ayurveda and physiotherapy in very nice way, and I adopted a lot of knowledge through physiotherapy between 97 to 2002. Then I started with integrating these all systems in my Ayurveda clinical practice, and my pain management become really effective. See, many a times, the pain management becomes really tough. And when I'm practicing through Ayurveda, people would have started already allopathic drugs. They are used to analgesics, possibly habituated. Withdrawal symptoms become so difficult. We can't reduce allopathic medicine. During that time, I started adopting Panchakarma and physiotherapy together. These two really brought me a lot of changes in patients' pain scores. And earlier, people used to feel 10 out of 10 pain scores. And when I started adopting these all scores, the pain management became very easy. Within a span of 2 weeks to 4 weeks, pain and all was really well reduced, and with the minimum medications. My intention was always I used to treat my patients for minimum 4 weeks to maximum 12 weeks protocols I had put. I never wanted to continue any medicines for long duration. That was not my interest also. My interest was, it should be for 4 weeks to 12 weeks protocols, not beyond that. Most of the times, most of the diseases also in either in chronic management, we could fit these all things through this 4 weeks to 12 weeks protocols. Similarly, when I had sometimes, seasonal exacerbations of certain diseases like asthma, allergic rhinitis, XYZ. During that time, possibly I would take, 6 months to 1 year, where seasons would have people should expose to season. Then they used to feel there is a necessity of medications or not based on seasonal exacerbation. We can't simulate seasons. Because of that. Sometimes I could say chronic diseases, sometimes they would take around 6 months to 1 year. Okay, a lot of diseases, respiratory diseases, really we used to manage well. And I used to complement with Ayurveda Panchakarma, where we used to practice Shodhana Chikitsas, where we used to do detoxifications, Grutapanas, regular Virechanas, Vamanas, and Vaktamokshana, all things we used to do for various diseases. And especially for respiratory diseases, we used to follow Nasyakarmas, and also we used to follow Vamana. These were wonderful, subjects to adopt and also to improve, one's a treatment protocol and accelerate the treatment protocol. The entire aim of treatment was to accelerate treatment so that we can reduce medicines and therapeutics as fast as possible. And my aim was to, focus these people after 4 weeks with a diet, nutrition, and exercise. I wanted to carry these people maximum for 12 weeks with the medicines and with the all kind of therapeutic management. After that, I feel any modifications in the body to rehabilitate or rejuvenate or regenerative, possibly it should take maximum not more than 90 days. I feel it even in a chronic cases. Possibly when I say about arthritis, for example, osteoarthritis, people with knee joint pain and people with low back pain and people with neck pains and all, possibly in a grade 1 situations, possibly they all will take 7 days to 15 days of treatment. That would be more than sufficient. In grade 2, possibly these people will take around 1 month to 1.5 months. In grade 3 patient, possibly they take around 3 months to 4 months. Possibly with the grade 4, it will take much more time to come back to the normalcy. But surprisingly, when I adopted these medical practices along with Ayurveda, physiotherapy, and also chiropractics, really the treatment protocols become very fast, and they started seeing all fast results. Within a span of 20 days, people used to feel pain relieved, and sometimes they used to come with a remission after 1 month or 1.5 months. There I used to again plan some 3 days to 5 days protocols and just follow up every 15 days once. And after 3 months, say goodbye to them. And if there is any problem, they have to come. They have to say, come and meet us. Otherwise, no need to meet. And just we used to educate them on diet, nutrition, exercises. This I used to do, and really enjoyed practicing this kind of work. And see, when I did my post-graduation physiotherapy and rehabilitation, there was a chance to work with a lot of acute management symptoms also. I could really understand well acute management, and really I could understand and interpret symptoms. Many a times Ayurvedic doctors fail to understand and adopt a lot of clinical knowledge, because they would have not seen acute symptoms, because this all can be seen only in modern hospitals in emergencies. And I would recommend most of the Ayush doctors to expose themselves and understand well when there is an opportunity to learn or relearn or adopt. See, always there is a possibility. There is nothing wrong to exchange your knowledge, and in a rightful way. I always say this rightful way. You have to understand the knowledge and also adopt it. That's what I believe in. And coming to I even adopt a naturopathy way of treatment protocols. I always keep in my clinic. I have assistants, therapy who manages my therapeutics, naturopathy doctor, a physiotherapy doctor, and an Ayurvedic doctor. Along with that, I have a therapist also. A team of 10 to 15 always will be there. And every day we see not less than 10 to 15 patients, OPD patients, and every day we'll see not less than 20 to 25 therapeutics. We'll try to manage, and this all is done very efficiently through our support team. Always I believe in the teamwork, exclusively done through efficient people. Okay, I adopt these people's knowledge, and of course I have also understood a lot of things when I get from a different zoner of medical practitioners. Whenever I interact with them, I'll get a lot of knowledge. Okay, coming to naturopathy, we always recommend naturopathic diet and nutrition, and also we adopt acupuncture, and also we adopt even acupressure points also, and even chiropractics also. I manage for some relevant patients. I do manage with chiropractics, and also say. And also, I'm interested in photobiotic therapies, and where I do manage with a very healthy, very evidence-based practices through photobiotic therapies. These are very effective, and these all accelerate treatment protocols. See, whenever I say rejuvenation medicine, it's very easy, where we have to practice maintaining fitness of a person. See, already a person is a fit, just rejuvenation medicine is more than sufficient. Put them simple Shodhana Chikitsa regularly for 3 days or 5 days, and give them some diet, nutrition, exercises, and give sometimes Virechanas every 6 months, 1 year, one. These all things really help them to rejuvenate themselves. Okay. And we always have to categorize people into three different categories. Okay. One is a patient who fit into rejuvenation therapies and rejuvenation diet, nutrition, exercises. Okay. These are all people who are seeking health and wellness. Basically, these people are seeking wellness because already they are fine. They don't know what they're having. We focus on understanding their problems or sometimes seasonal exacerbation much ahead. And we try to evaluate them through Dashavida Parikshas, modern protocols, or allopathic protocols or Ayurvedic protocols. And if required, we put them into different investigations, maybe Nadi Parikshas or any kind of blood evaluations or recommended very healthy investigation protocols. See, when we understand these all people, we can really come to know how we can, investigate and how we can, prevent the disease which can happen in near future. Okay, for example, most of the anemia patients who are lowering their hemoglobin, especially in women, menstruating women, they'll be not knowing about their anemia factors. Surprising results we'll find whenever we do blood tests. Of course, clinical evaluations also will prove, but sometimes when you substitute with the proper clinical evaluations, understanding biochemical parameters, it will be very easy to convince patients and also bring evidence-based studies. Always I used to practice evidence-based studies. The day when I started my clinical practice, I used to write each and every details in my case sheet. The day one, I am a very keen listener of a patient, writing their problems, taking their subjective, objective assessment plans. Through I'll write and I keep proper records of them, and also follow-up records. I'll keep it, and I'll see that these all people are followed up for minimum 3 weeks, maximum 4 weeks. The moment all the treatment is over, I'm going to take their feedbacks. Okay, and very rarely, out of 100, around 10 patients may require more than 3 months protocols. Very rarely we see that. Okay, and most of the diseases can be well managed through our protocols. I was talking about rejuvenation, medicine and patients who require these things. Okay, these people are young generation people, are people, or even I can say even older generation, because I have seen children from 0 years to 92 years. Okay, 92, 94. Even last recorded patient is 97 years. He was so nice, he never had arthritis, any issues with that. He used to come regularly, take some rejuvenation programs with us, and he used to go back. Such a records we have. It's really to say some people really believe in Ayurveda so well, and they practice, they implement themselves, and they are much knowledgeable than people who practice even Ayurveda also. Because ancient cult, more than 30, 40 years, hardly there is any safer, 50 years back, hardly there is any safer allopathy. See, entire fraternity of our doctors were, they're all practicing mixed medicine. Possibly in a earlier national Ayurvedic practitioners, they used to practice more of Ayurveda, very less of allopathic compounds. But during the period of around 30 to 40 years or 50 years study, there's a lot of subject which has been updated, subject been adopted. A lot of scientists have contributed, a lot of investigation teams have contributed, a lot of research on medical faculties. Really, we have to appreciate them also. And sometimes what will happen whenever we adopt this all things, our knowledge also will improve. And wherever necessary, I don't say like all people will require emergency medicine. I don't say all people require surgeries. For example, tonsillectomies. We see a lot of patients unwantedly going for tonsillectomy. It's not at all required. See, because I'm expertise in respiratory medicine, whatever tonsil enlargement is there in children, we can really reduce well with our simple Shamanaushadha chikitsas and proper observation with the diet, nutrition, exercise, little re-education. Possibly it may take little more time because this is a seasonal exacerbation we see in children, and they won't understand properly. Well, possibly they may take, instead of 3 months, they may take again next season, possibly 1 or 2 months like that. But these people initially start with cold, cough, and fever, and enlarged tonsils, sometimes adenoids, and also they start having cough. Okay, some children also even have a wheeze. Okay, then wheeze comes. These all children will go for steroids usually. At that time they'll come to us, or some children they'll come at an early stage to Ayurveda. If at all I say, out of 10 children who are having respiratory illness, in that 5 or 6 people, 5 people directly come to Ayurveda. There is a lot of belief in Ayurveda. They'll come and they really heal well. There are these all other 5 children, they may not like Ayurveda. They would have taken some allopathic medicines and it's not come down. They ultimately have come to steroid level. At that time they'll come. Possibly here, no, the entire rehabilitation will take little more time. So whatever has become chronic, we have to rehabilitate them. There is a real, respiratory parameters we have to check, and we have to focus on upper respiratory infections and also lower respiratory infections. We have to really plan well with Ayurveda medicines, and definitely we can reduce allopathic medicines in these patients. We can really taper them, and we can really, reduce the entire kind of allopathic medicine. We can put them completely on Ayurveda medicine. They'll be totally healed. Okay, and we can really prevent surgeries of tonsils. That's a very important part. Where I have tried in many patients, I'm very successful in prevention of surgeries. When I say prevention of surgery is a very important factor, we have to rehabilitate them. When I say rejuvenation, if you plan rejuvenation properly, you may not require rehabilitation. But people who are not rejuvenating themselves, who are not taking care of themselves, who are not really into wellness programs or self-adopted programs, self-lifestyle program, all people will end up in rehabilitation medicine where they
So,
require.
your voice is little low, sir.
Okay.
The
Okay. Is it audible?
attendees.
Is it
Yes,
audible?
doctor, it is audible, but it is little low.
Okay. Okay. Fine. Is it fine now? Should I
Yes,
increase my
doctor,
voice?
it is perfect. Yes,
Okay.
yes.
Fine.
Thank
Okay.
you so much.
Hope everybody are able to understand whatever I say. And however, after another 10 minutes or 15 minutes of my slides, we'll have a open discussion.
Open discussion. Now it is audible, doctor. Thank
Now
you.
it's audible. Okay. Fine. And say really, when I say rehabilitation medicine is very important, where it has gone to chronicity, and we are trying to revive it. Possibly cellular repair will happen here, and it'll try to rehabilitate completely. Okay, there is one more important part of medicine. What I say is a regenerative medicine. For example, there is a advanced aging. For example, when I see a person who is around 50 years or 60 years, he looks like 70 years or 8 years. We say advanced aging. Some procedures, some process in the body is making much weaker. A person who is supposed to live 120 years, he starts living only 100 years. And person who's supposed to live 100 years, he's living only 80 years. See, the entire span of our aging is slowly shrinking. Okay, and where the role of regenerative medicine really comes well, and where adoption of our Ayurveda knowledge really comes very well here, and using Rasayana Aushadhis and Shamana Aushadhis, also planning entire Panchakarma therapeutic management and planning proper, physiotherapeutic exercise protocols and all, really help a person to really improve them a lot. Okay. And when I say regenerative medicine, for example, in grade 4 osteoarthritis, where patient is around 65, 70 years, possibly even regenerative medicine, sometimes it may fail. Out of 100 patients where we try to revive, 70 to 80%, definitely we can heal them through our medicines, and possibly 10 to 20% of the people, they may require surgeries, where total knee replacement surgeries may require in such patients, where there are so many other things which are involved here. Hope I'm audible to everybody now.
Yes, doctor.
Okay, fine. Okay. And the whole focus is to, support where is required, and, direct them where exactly the requirement is. Okay. Whole idea of our holistic medical practice is treat mind, body, and spirit, and try to, use less chemical compounds and more therapeutic procedures or natural way of diet, nutrition, exercises, so that they can heal well. That's the entire length of holistic medical practice.